Hello, my name is Dr. Olubukola Ayodele. I'm a consultant medical oncologist. What that means is that I treat breast cancer, and today we'll be talking about screening. Screening is very important because screening tells you about a disease condition before it's apparent or before it starts to show. Screening is important because breast cancer might not present with any symptoms, and screening is for well people. I need to repeat that again. Screening is for well people. I think a lot of times people get confused thinking that you need to have symptoms to go for your screening. Actually, that's very wrong. So screening is actually for people that have no symptoms, and the reason being that you want to catch the cancer if there's any very early, which means that the outcomes from that is very high and very good. So for breast cancer, the gold standard for screening is something called a mammogram. And a mammogram is a low-dose X-ray for the breast. This is usually done on both breasts at one at a time. You're usually invited depending on where you live. If you live in the UK, then the invitation is for women aged 50 to 70 every 3 years. If you're beyond 70, you can request for screening. However, these are the ones that normally would be sent invitations. We do know that currently the uptake for screening in the Black and Asian communities is quite low compared to other communities, and some of the reasons that we've identified is just fear. We know that when it comes to screening, the Black and Asian communities don't always get to go for their invitations. This lack of engagement is costing life because it means that women in this demographics or in this ethnic minority groups are presenting quite late, meaning that you get to have more complex treatment and poorer survival outcomes. I know that a lot of this is because of the stigma associated with cancer in these communities. Some of it is from the fear of the unknown, some of it is just language barriers, and some of it is just not wanting to burden your loved ones. But it's really important that you go for this screenings if you're invited, because early detection does save lives. It makes the lives of everyone less complicated for your family, for your carers, because there's less treatment involved, and the outcomes tend to be better when breast cancer is detected early. So my advice would be, if you have an invitation, please honor that invitation. If you know someone who has been invited, please do encourage them to go for their screening test. So remember, until next time, keep checking, and please do honor your screening test and screening invitations.